I'm Julie, and I currently live in Houston, Texas with my family. I have a husband and 2 kids, and I also live with 2 dogs. I'm currently a physician assistant at MD Anderson Cancer Center in the leukemia department. I'm also a supervisor of advanced practice providers. I received my Bachelor of Science in Chemistry, and from there I decided to pursue my Master's of Physician Assistant. A typical day, I usually wake up around 4:30 in the morning. I go do a workout class. And then once I get back, my husband and I kind of take turns getting the kids ready for school or camp, whatever it may be. That involves me making breakfast. I also picked up playing piano because that's been one of my goals ever since I was younger. So when I started at MD Anderson, I had the privilege of working with Dr. Verstovsek, and he is the head honcho of MPNs. He really made me want to pursue my expertise in MPNs. Because this is a chronic disease, I have the privilege of seeing patients so frequently. And I think if one of those patients, you were to ask them what they thought of me, they'd probably say that I'm caring, I'm efficient, I listen, and I do whatever it takes to make sure that they're doing well. When patients first come to us as a new patient, good, here's your blood work. Obviously, they're a little bit wary or concerned because this is a new diagnosis, and if they attempted to Google anything about MPNs, they were probably freaking out about it. And I think that's where my role as a PA can be helpful, right? I can come into the room, I can put them at ease, explain to them what the disease process is, what to expect from here on out with their treatment plan or with their stay at MD Anderson. I get to know them as a person. I get to know what their hobbies are when they're traveling, what their families are up to. There's just something so rewarding about getting to know these patients on a personal level rather than just as a clinician-patient relationship. I became supervisor for the advanced providers about 3 years ago. The thing I really enjoy about being a supervisor is I feel like I can provide the time needed to really listen to my colleagues and see if there's any concerns they have or maybe even ideas to improve the department or our workflow. Outside of MD Anderson or any academic institute, you might be lucky if you see 1 or 2 patients with this disease. So I think it's really important that even though it's so rare, that the local oncologists or local providers or local nurses, whoever it may be, are aware of what the disease is, how it can impact their patients, what treatment options are there. Whenever I get a chance to go out there into the community and talk to providers, there's just such a rush and an enjoyment out of seeing their faces when they finally understand, like, this is what's happening and this is why it's important. A few years ago, I decided that I wanted to pursue a doctorate in medical science. I wanted to do more for patients. I wanted to learn more about research and be able to explain and translate the data and research to patients so that they can understand and make an educated decision on whether or not this treatment is right for them. In terms of the infusions, you're not getting... I love patient care, and I also love education. So I think one of my goals would really be to use my doctorate in medical science, not just to educate patients, but also to help educate providers and nurses. I think what's special about MPN patients is that every patient has a story to share, and it's very humbling that they're allowing me to be part of that story and to be a part of their families, really, because I get to know them so well through all the years we take care of them.